County Board of Commissioners regular session for Monday, October 16th, 2023 to order. Madam Clerk, if you will, please call the roll.
Commissioner Hunt?
Here.
Commissioner Mark? Commissioner Mitchell?
Here.
Commissioner Smith?
Here.
Commissioner Howard?
Here.
Vice Chairman Booker? Chairman Jones?
Here.
Mr. Chairman, we do have Commissioner Mark on audio on a phone, so let me just make sure he can say aye. Commissioner Mark, are you there?
Yes, aye.
Okay. Commissioners, I will just state for the record, due to having Commissioner Mark remotely today, all votes will be by roll call. If I happen to miss one, don't mind reminding me. But per our bylaws, that's how we're supposed to do. If the minutes will reflect, our vice chair is coming in late this morning, but he is here. We'll give him time to sit down. Welcome, Vice Chair Booker. While we're waiting, I'll just go ahead and turn a few things around this morning before we have our prayer and pledge. We'll welcome each of you here to this Board of Commissioners meeting. Thank you for your attendance. To those who may be viewing online, we welcome you this morning. I would ask that all of us to make sure that our phones are on silence so they wouldn't disrupt this meeting. We would appreciate it. And at this time, I'm going to, ladies and gentlemen, ask if we could stand together. Our County Attorney, Mr. Grady, is going to lead us in prayer. Then I ask you to remain standing for the Pledge of Allegiance to the American flag.
Heavenly Father, from the endless bounty of your love for your creation, you provide all that we need. As your people, we confess our trust in you, believing that you care for our welfare. In God we trust, we proclaim on our currency. Yet the people of this nation also put their trust in these elected commissioners. We trust that they will do your will and provide justice to ensure a quality of life that you provide. Protect these honorable commissioners, give them your wisdom so that their decisions may reflect your desire for your people. Give them a quiet assurance and guide them in the difficult times. May your will be reflected through them, and may your people be blessed by their leadership. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Commissioners, you have before you your agenda packets. Are there any items that you desire to add or to pull from today's agenda? Here none. Do I have a motion that we approve the agenda?
So moved.
Do I have a second? I have a motion and a second. Any discussion on the motion? Here none. Madam Clerk, if you will, please call the roll.
Commissioner Hunt?
Yes.
Commissioner Mark?
Yes,
Commissioner Mitchell?
Yes.
Commissioner Smith?
Yes.
Commissioner Howard?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes. Item 1 is the consent agenda. You have there the minutes of the October 2nd, 2023 regular session and tax releases and refunds. Are there any consent agenda items that you desire to pull?
No, sir, and I make a motion that we approve the consent agenda.
Second motion.
Okay, we have a motion and a second to approve the consent agenda. Any discussion on the motion? Here none. Madam Clerk, if you will, please call the roll.
Commissioner Hunt?
Yes.
Commissioner Mark?
yes,
Commissioner Mitchell?
Yes.
Commissioner Smith?
Yes.
Commissioner Howard?
Yes.
Vice Chairman Booker?
Yes.
Chairman Jones?
Yes, thank you. All right, departmental matters. We have item 2, social services. We have with us Mr. Jeffrey Merritt. Good morning, sir.
Good morning, Chairman, Commissioners, County Manager. Today we bring before you 2 budget amendments. The first being the Low-Income Household Water Assistance Program. If you remember, that was an American Rescue Plan Act program that ran through the end of May. And as they do with our low-income heating and energy assistance program, they take any leftover funds and give a supplement to all of those that receive. So we have been allocated funds in order to cover that amount in the amount of $57,335.38. These are all federal funds, no county match. And we ask that you approve the budget amendment in order for the budget to be able to cover those funds.
Okay, any questions for Mr. Merritt? Just one question, Mr. Merritt. We had this before, correct?
Correct.
And did we utilize most of the funding that we had?
I would say Craven County utilized the most of it. We spoke about this program, and they gave us a good amount of funding, but the water bills aren't as high as what your electrical bill would be. So that funds weren't expended as quickly as the state hoped that we would, but we communicated the funding to the public, and I think we utilized a good amount. I can get you that number if
It's all
you
right,
like it. So, but
just get an idea.
yeah, I do know that there were reports about the funding being utilized through counties throughout the state, and Craven was at the upper end of those who have used the most of their funding. So
That's good. Any additional questions? All right, hear none, do we have a motion?
So moved.
All right, do I have a second?
Second.
I have a motion and a second to approve the budget amendment in the amount of $57,335.38. Any further discussion on the motion? Hear none, Madam Clerk, if you will, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Aye.
what was that?
Aye.
None.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. And then item B.
Yes, these are Adult Protective Services essential funds, and these are also the continuing flow of American Rescue Plan Act that the state sees that are passing down to the counties. And what these funds do is to help offset county costs. You may remember our social services line item and our adult services line. To when we become involved with individuals through Adult Protective Services or guardianship, whom either through Adult Protective Services, we see that there's an urgent need to prevent serious risk of harm or even death, and we have to put in interventive services like, in-home aids, or have maybe a nurse go by there because someone's bedridden, they need some medical care until we can find them a more permanent solution. So this is one of these funds were given to counties to kind of help offset some of the county's costs, because our state partners give essentially no funding to assist in these matters. So, but they allocated some American Rescue Plan Act, so the $17,990 will go to offset costs that would originally have been county costs, and now we can use these funds for it until they're spent.
Okay, any questions from the board? All right, hear none. Do you have a motion?
I move to approve the amount of $17,990 budget amendment.
Okay, we have a motion and a second. Commissioner Hunt did read the motion for the budget amendment. Any further discussion on the motion? Hearing none, Madam Clerk, if you will, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. Thank you, Mr. Merritt.
Thank you.
Appreciate you. Thank you for what you do. All right, item 3, we have Mr. Scott Harrelson, our Health Director. He has right many items this morning.
Quite a few this morning.
Welcome this morning.
Thank you for having me. And I have a combination of budget amendments and updated fee requests. These have all been run through the Board of Health and now bring them and approved, and I now bring them to you for your consideration. The first is additional federal funding in the amount of $24,603. This is another benefit of being a federally qualified health center as well as a local health department. These funds came through HRSA, which is on the federally qualified health center side, and they are basically to purchase COVID vaccine. Honestly, we have not seen a great demand through our clinics for the new COVID vaccines, but they are quite expensive, ranging anywhere from $128 to $167 a dose, and this funding would go to help cover the purchase of those.
Okay, any questions for Mr. Harrelson?
I have a question.
So do I.
With these funds, it does not mean that the public will get that vaccine free. That's to lower the cost. Is that correct?
That is correct, yes, ma'am.
My question would be, because you said that you don't see a high demand for this, and the vaccines seem to change every couple months with the vaccines and the boosters and so forth, will you be expending all $24,000 plus at this time, or are you going to buy what you need as needed?
We plan to purchase the latest version of the vaccine all at once. This does not buy a whole lot of doses with less than $25,000. And what we would do is probably situate the shots on what we were doing was situating the shots on one day because it was a 10-dose vial. It's my understanding these are smaller. You can break these up into smaller, so we may have them on multiple days, which will provide a little bit more flexibility for the public than just waiting on one day. Now, and later on this morning, I'll be asking for fee approvals, but you'll see that through those fee approvals, the Medicare reimbursement rates for these, so Medicare does cover the cost.
My concern is that we would buy something that wouldn't be effective in 2 months and have to discard them and move on to the next.
As the Moderna and Pfizer product that we plan on purchasing with these seem to be what will be available for the foreseeable future.
Additional questions? Commissioner Howard?
My question may be slightly off topic, but I was given, it is about COVID though. I was concerned, was shared with me from school board members that were kind of pushing the mask mandate back into the school systems, and their direct concern was from your office. Are we trying, as in the health department, to push a mask mandate back into the school system?
Commissioner Howard, we are not. Actually, there was a direct question to our state counterparts if there were any planned, from communicable disease branch for masking in schools, and they said none whatsoever. I think that may have been a confusion point with a child maybe going out with a positive COVID test, and they're out for 5 days, and then the guidance still remains, they're supposed to mask for an additional 5 days. Outside of that, I wouldn't see any other reason for anybody from the health department to tell anybody in school to wear a mask.
Thank you.
Yes, sir.
Any additional questions? All right, here none. The board action that we are requesting this morning is to accept the federal funding to approve the budget amendment in the amount of $24,603. Do we have a motion?
So moved.
We have a motion. Do I have a second?
I second the motion.
Okay, second. Any further discussion on the motion? Here none. Madam Clerk, if you will, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. All right, B, the use of fund balance appropriation.
Yes, sir. This coming after the end of the previous fiscal year, we enjoyed revenues over expenses a little over $1 million. And these are items that we basically, they're one-time, usually equipment or renovation items that the department is in need of, and the total request this year is $319,559. We also work with the county manager's office on some of the things that may be needed at some of the facilities. As you look up, just to give the public an idea of some of the things requested, a good number of them are at the animal shelter. We have things like ultrasound machines, portable storage units, GPS handheld units for environmental health, analyzer for our lab, which was over $50,000, and nitrous cart with flow meters for our dental program, exam tables, etc. These are just to give a good idea of what kind of items are on the list.
Okay, any questions from Mr. Harrelson?
I have one.
Yes, ma'am.
What's that analyzer for? What are we analyzing?
Yes, that, as it was explained to me by our it's a test that we run a high volume of, and it's basically something that we're doing now by hand, and it's that we can have human error in it. Some of the analyzers are also used in labs in the private sector in the area. I believe I said that, for instance, CCHC has one as well. But it's it's a growth analyzer with some of the specimens we take, and right now it will cut our response time down and also cut out some of the human error in that. And we think that we're trying to increase our patient volume in primary care from 5,000 to 6,000 or more. So we feel like we'll be running more of these tests in the future and not less.
And Mr. Harrelson, I believe directly this analyzer works towards skin conditions. It was culturing different types of rashes, MRSA, looking for things like that, which when we talk with the lab supervisor, what we're having to do now is like a 3 to 4 day. So if you got somebody with a problem, that's a long time to wait, and this is like 3 to 4 hours. So it shrinks that time greatly.
All right, Commissioner Mark, you have a question?
Yeah, why is the money coming from Greenville and not directly from social services?
So,
I mean, from the health department. I'm sorry.
yes, sir, Commissioner Mark. Let me address this. So, during the year, because we see a disproportionate number of Medicaid patients, that's what health departments do. We are cost settled with Medicaid, meaning they know that we're losing money on these patients, so the federal government comes in and subsidizes that to a greater degree. We don't know this amount until after budget's done. So probably for the last 15 years, we've at times delayed some capital expenditures because we know we're going to have an influx, and Mr. Harrelson said over $1 million this year, correct, Scott?
Yes, sir.
So we always allow a portion of that to be reinvested in our health department where the money was earned. It gives us a strategic advantage that we can keep the tax rate lower because we're not looking for $350,000 worth of stuff from the general fund of the county. So this is probably a little bit larger than we've normally done, but some of the pieces of equipment for our lab, and we have a new lab director who has some idea about getting more timely results to our patients. That's generally why we're in the 300,000 range. It's usually about 250.
All right,
Okay, thank you.
Yes, sir.
additional questions? All right, here none. The action requested is to approve the budget amendment of $319,559. Do I have a motion?
So moved.
Second.
I have a motion and a second. Any further discussion? Here none. Madam Clerk, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Yes,
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Bucher,
Yes.
Chairman Jones.
Yes. All right, and C is the hospice billing rates.
Yes, as you know, hospice had a rough year last year, but they are having a much better year this year. We're fully staffed and getting a lot of referrals into the program, and I think they're doing a wonderful job. This was fortuitous for us because Medicare decided to increase hospice rates, and the rates we bring to you today are for routine hospice care, $219 a day, continuous home care, $66 per hour, inpatient respite care, $508 a day, and general inpatient care of $1,146 per day. Now, we may utilize all four of these, but the main one for us that we do utilize by far the most is the routine hospice care of $219 a day. Currently, the rate's at $212 a day, and with our average census from the past few months or first quarter of this year, my finance officer tells me that that would mean an additional $7,500 a month for the hospice program.
Questions from the board? Commissioner
this-
Smith.
Is this a cost to the patient or does Medicare?
Medicare, no cost to the patient.
Okay,
Yes,
cost to
ma'am.
the patient. Good.
All right, additional questions?
What I can tell, we're just moving these prices up to the Medicare rate anyway.
Yes, sir.
It looked like, okay.
Yes, sir. And you'll see that again on the next fees. We usually just try to round up to the next dollar.
All right, any additional questions? All right, here none, the board action is requesting the new billing rates for hospice to be effective retroactively on October the 1st, 2023. Do I have a motion?
So moved.
I have a motion
Second.
and a second. Any further discussion on the motion? Here none, Madam Clerk, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
yes,
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Bucher,
Yes.
Chairman Jones.
Yes. All right, next is the immunization fees request.
Yes, and again, these are basically rounded up to the next dollar for over the Medicare rate. So I'll try to give a brief explanation. The first one is just COVID-19 vaccine administration rate of $65. The second one is Rotarix oral vaccine. This is prevention of a rotavirus, gastrovirus, and the proposed rate is $138. That's Medicaid rate is $137.99, so we propose $138. The third is Moderna vaccine. They call it Spikevax. It's from Moderna for COVID, and it's $134, and that's for 6 months to 11-year-old. And the adult version for 12 years and older is also $134. Medicaid, Medicare rate at $133.39. Then quite a few here. Bear with me. The next up is the Pfizer COVID-19 vaccine for ages 12 and older. Proposed rate $124. And then the next up is an RSV vaccine, and this is for common and contagious viruses, mild colds, in older adults, and proposed rate of $289. Medicare reimbursement is $288.40. And then Shingrix for the shingles vaccine. Medicare rate's $188.91. We propose a rate of $189. And last but not least, one that I was glad to see for Tdap and the childhood immunizations. They're now Vaxillus is a combined vaccine, so that the little ones don't have to have as many injections in their little legs when they go to be vaccinated, and that proposed rate is $147.
All right, any questions?
I have a question,
Yes, ma'am.
probably just me. But earlier you stated that the health department was asking for us to approve the $24,000 plus for the COVID vaccine.
Yes, ma'am.
And I heard you, as you were reading that, again, asked for, I thought this funding for COVID vaccine. Am I incorrect in thinking that?
These are the fees, and that was actually some funding that came to us. We weren't even aware was coming to purchase the vaccines.
I understand that, but with that fund coming, didn't you just ask for additional funds for COVID along with other vaccines? Maybe I misheard.
Okay.
She thinks you're double charging.
Getting the vaccine paid for and then.
Twice. I thought I asked for twice. I thought I heard twice, but
Now, we can, on certain occasions, if there is an opportunity to purchase the vaccines all along, like with COVID, we could bill for Medicaid or anything throughout the pandemic. So, yeah.
all right.
Okay, any additional questions? All right, hearing none, we're being asked to approve the new fees to be effective retroactively on October 1st, 2023. Do I have a motion?
So moved.
I have a motion. Do I have a second?
Second.
A second. Any discussion on the motion? Hearing none, Madam Clerk, if you will, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Yep.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Bucher,
Yes.
Chairman Jones.
Yes. All right, and then E is the additional funding from Pitt County.
Yes, Pitt County was gracious enough to be the hub county for a regional effort. For whatever reason, that is how the state wanted to disperse these funds. I think that they learned a bit of a lesson that we're really not set up to move funds around that easily because we're just not set up in a regional framework. It was a little cumbersome, but the good folks in Pitt County kind of worked through the process, and now they're trying to disperse those funds out to every county in Region 10. And we had a little over $170,000. They've already sent us a portion of our money, but the remaining amount we had for Craven County out of those funds was $149,177. And with those, we can do the I2I, second year of the I2I data pilot for public health data and information. We can put it towards some of our staff hiring recruitment costs. And we can also use it for employee furniture and computer equipment, which will come in handy with the potential Havelock expansion and also using it up here in New Bern as well. So that would be $149,177.
Okay, any questions for Mr. Harrelson?
I have one. This is not reimbursement for what we have already spent. This is money that will be, monies that will be available to be spent.
Yes, ma'am. We haven't spent any of this money.
Okay.
Yes, ma'am.
Thank you.
All right, additional questions? All right, hear none, you're being requested to approve the budget amendment in the amount of $149,177. Do I have a motion?
So moved.
Do I have a second?
Second.
I have a motion and a second. Any further discussion on the motion? Hearing none, Madam Clerk, if you will, please call the roll.
Commissioner Hunt,
Yes.
Commissioner Mark,
Yes.
Commissioner Mitchell,
Yes.
Commissioner Smith,
Yes.
Commissioner Howard,
Yes.
Vice Chairman Booker,
Yes.
Chairman Jones.
Yes. Thank you, Scott.
Thank you.
Appreciate it.
Before he leaves, could I ask a question?
Yes, ma'am.
I would like for you to share just one moment of how the drug store has enhanced your health department.
Oh, yes, ma'am. Our pharmacy, it has actually self-sufficient now. When we started it out, we had some federal funds, some grant funds to go towards the cost of the staff, and the staff, one pharmacist and 2 pharmacy techs. And what this has allowed us to do, our staff, our clinical staff used to do prescription assistance programs, very time consuming, and they changed from week to week. And you had to run our patients from one pharmacy to the other, whoever may have had the best deal of the week. And sometimes you couldn't find what the patient needed. And sometimes they need a prescription med that was very expensive. But now we can get any medication. I haven't heard of one that we could not get our hands on for pennies on the dollar. And a lot of people are taking advantage of it, and to the point that now the pharmacy is self-sufficient. It is making enough money to cover its costs and make a modest profit. Not a great deal, but that's what we wanted to do, just be able to put and that helps us to stabilize, the patient population we have. And if we can get at those 5,000 or 6,000 most needy folks in this area, right now, I know we're working with the Mercy Clinic. With the Medicaid expansion, some of their people will be rolling over to Medicaid, and we've agreed to take on all of those folks over at the health department, and it's wonderful.
Thank you.
Commissioner Hunt?
Mr. Harrison, is the pharmacy providing over-the-counter meds at a low cost as well?
They do, yes, ma'am. Not only the prescription, but over the counter, and we actually put our pharmacy techs in a county vehicle, and we'll even deliver to the house on certain days a week.
Vice Chair Booker?
Scott, just a clarification. We do not at the pharmacy have any controlled substances. Is that correct? Controlled medication.
That's right, yes, sir. We refer those out.
Unlike a Relo or a Rite Aid or any of those.
Yes, sir. No pain medications. We refer those out to pain management centers.
Thank you.
Yes, sir.
And my second question would be regarding Medicaid expansion and what's going on at the health department related to Medicaid expansion for the just for everybody's information.
Yes, sir. We think that we've got roughly 1,000 uninsured adults right now. We think that 65 to 70% of them will probably be able to take advantage and get Medicaid. Some of the folks over at the free clinic will also. So we know that we need more capacity, and right now we have been fortunate enough to find those 2 new providers. And what we want to do is expand from we are running 2 providers down in Havelock right now. Now, these are wonderful candidates, but they're new to being a nurse practitioner, right? They've been nurses for years. So there's a certain period of ramp up and having them credentialed and having their DEA number set. So we're in that process now. But pretty soon we feel like they'll be able to carry a full patient load, and certainly hopefully by December. And one of our providers is Naval Reserve. She'll be going out of the country basically the month of November. So, but she'll be back in December as well. And we're basically trying to ramp up and beef up our staffing complement and more providers. But to be honest with you, with the number of providers we have now, it's as much as our space can accommodate.
Thank you.
Yes, sir.
Commissioner Mitchell.
Mr. Harrelson, now that the pharmacy has made medications, prescriptions more available and more affordable to the patients that you see at the clinic, do you have an estimate or a way to track how many more patients are able to medicate themselves properly and address their conditions than before the pharmacy was available?
Well, I will say we can put something together. We have some pretty good reporting capability, and that's not a compare-contrast we've actually put together yet, but we can.
I'd be interested in seeing that, because I know a lot of people got prescriptions but they couldn't afford the medication.
That's right.
And then later ended up with worsening health problems. So I'd like to see the impact of the medication availability on Craven County.
And also, I know that the Carolina East Foundation has been assisting us in that. They have a dollar amount, I think it's $350 per year. So if somebody is having difficulty coming up with their portion or their money, then our pharmacy works with them to try to help cover some of those costs too.
Yes, thank you. I'd like to see that at some point.
Yes, ma'am.
Any additional questions? Yes, ma'am.
How many additional children do you foresee us picking up with the Medicaid expansion?
I think that most of the children that would have Medicaid already have it. I think I'm thinking that, or we're assuming that most of this will be probably a little younger, healthier adult population that may not be going anywhere right now. Because I think, 5,500, I can say that 1,000 we've got that's uninsured, but I wonder where the other 4,500 are going,
Just one more thing. I've had a couple of calls about your new FMP down in Havelock, and I'm getting excellent reports.
Oh, that's good. Good news. I will let Lauren know that. Thank you.
All right, thank you, Scott. We appreciate it.
Thank you all
Good day.
for the support. Appreciate it.
All right, Commissioners, next on the agenda, item 4 is the appointments you have pending. Does any commissioners have any nominations for any pending appointments? All right, hearing none, we will move to current. Under current, we have the first is Fireman's Relief Fund. You have the applicant of Adam Fulcher, who seeks to fill a vacant seat on the Township 2 Little Swift Creek Fire Department. Commissioner Mark, are you still with us? All right, if not, I'm going to nominate Adam Fulcher on behalf of Commissioner Mark. I think he is in favor of that. Are there additional nominations? Hear none, we will accept him by acclamation. Next would be the Havelock Board of Adjustment. You have an applicant of Ms. Palmer, who seeks to fill a vacant seat. Commissioner Hunt, Commissioner Howard.
I would recommend that we give Jacqueline Palmer the appointment to that seat.
Okay, we have a nomination. Are there additional nominations from the floor? Hear none, we will set by acclamation. All right, then you see the upcoming terms expiring in November. Please take note of that. Are there any additional appointments to consider today? All right, hearing none, we will next go to the County Attorney's report. Mr. Grady. Good morning, sir.
Good
Morning, Mr. Chairman, Commissioners. I have one item for the board's consideration this morning. It involves county-owned property that we acquired with the city of New Bern through the tax foreclosure process. This is before you for final approval. The property is at 837 Pavey Avenue here in the city of New Bern with a parcel ID number of 8-007-097. The board originally approved an initial offer of $12,333, but there were multiple upset bids, with the last and highest bid being $18,000. The upset bid period is now expired, and I recommend approval of that bid of $18,000. The city of New Bern has already approved it. The original foreclosed taxes and the cost of foreclosure were $6,210.10, and the tax value of the property is $42,130.
Okay, what's the desire of the board?
I move to adopt the resolution approving this.
Okay.
Second.
We have a motion and a second to adopt a resolution approving the conveyance of partial number 8-007-097 after the upset bid process. Any additional discussion on the motion? Hearing none. Commissioner Mark is not with us. Okay.
He dropped off.
He dropped off, all right. All those in favor signify by saying aye.
Aye.
Opposed? Motion passed.
Thank you, Commissioners.
Thank you, sir. County Manager report.
Morning, Mr. Chairman, Commissioners. Thanks for the opportunity. I'm going to be brief because we have a work session immediately following this. Mr. Chairman, we will need a 20 to 25-minute recess to flip the room and get everybody situated. The ribbon cutting that was scheduled for today the groundbreaking ceremony scheduled for today for DSS will be the second meeting in November, and I believe that is November the 20th. We had a delay on a permit. We weren't quite ready to turn dirt yet this morning, but we will on November 20th. So if you would mark that for your calendar. We do not anticipate there'll be any additional meetings after that, so we'll break from there. Just a reminder for your calendar, October 19th this week at 9:30 a.m. at the Convention Center is the Transportation Summit for Eastern North Carolina. We are a host of that. I hope you can attend. Lots of good speakers, lots of great updates about DOT, and a brand new transportation secretary for his first remarks as secretary at our event. So we're excited about that. Lots of participation from the region. I tend to believe we're the focal point in the center, so I'm glad it's here, and we'll keep that moving. Last week, Chad Strong and I were able to attend a briefing in Onslow County related to FEMA and BRIC funding, along with how it can compound with REPI funding. It's a very complicated federal government process because you got two buckets of money. Very well attended by Craven County and the base. There are some projects there. These tend to be more outside the fence projects that enhance the ability for the Marine Corps to do their job. So how they can do that is REPI has a pot of money, BRIC has another pot of money. The REPI money can be used as the match to the BRIC, meaning at very little cost to the county who would have the project. That's why they're trying to marry those two programs together. However, in sitting through 3 hours worth of federal red tape, I'm not exactly sure. I want to see a test case and how FEMA money can go to that. But anyway, it sounded positive. They're going to continue convening this group and trying to move some projects forward. Lastly, a very special occasion today. It is our finance minister's birthday today, Craig Warren, as he's been called before, our finance director, Craig. Happy birthday to you, buddy. Thank you. Mr. Chairman, Commissioners, that's it to the work session.
Questions for the county manager? All right, thank you, sir. All right, we'll start with Commissioner Mitchell this morning.
Nothing to report, but thank you.
Okay, Commissioner Howard.
Just a couple of things. I went to the Eastern Carolina Council of Government meeting the other evening, and an interesting program that I will be sure to share with my constituents was the PACE program. I don't know if Jack is aware of it, but it seems like an interesting statewide program, not-for-profit, building a new hub near the Bosch plant. The program's goal is to keep people in their homes, so once you get to a certain age, sometimes it's hard to stay in your home. This program's entire goal is to, and it's basically an insurance program, is to keep people in their home. And provides, I mean, some of the services and some of the examples he gave were kind of extraordinary, like, someone with COPD, the air conditioning goes out, they go in there, they replace the air condition. Because, it may not seem like a medical expense, but if that's part of them staying in their home, that's what they do. Seemed pretty interesting. Something like 97% of their funds go back into keeping people, the medical expenses of people who sign up for this insurance program. So once you're signed up, if you go in the hospital, he had another example of somebody spending 6 months in the hospital and that they spent $300,000. If there's no expense for your medicine or anything like that once you sign up. So as the program, there's 10 different regional programs in the state, I believe. So they're expanding here. They're 100% in Craven County, 100% in Jones County, and I think 100% in Pamlico County. They're in most of the zip codes in Carteret County. They've expanded into most of the zip codes in Onslow County, but they're continuously expanding across the state. Just seems like a really good program where the goal of the program is to serve those. They said, of course, they want to keep their budget balanced, but that's a secondary or even third goal. They need to be solvent and those things, but their primary goal is keeping folks in their home and healthy, which I thought was a neat program. Of course, if you're Medicaid eligible, I don't think there's any cost to you. And it goes up, there's a scale from there. It goes up once you make above a certain amount of income after retirement. But a neat program. The other program, which unfortunately has ran out of money, and which I had heard about before, was the grocery reimbursement program. But how that was utilized in our region was a surprise to me. It was available to folks that were 60 and over, and they went through the $900,000 in not a short period of time, but I think over 12 months, a little bit over 12 months. And people are still sending in their receipts. Unfortunately, they're having to send them back because the funding that they received is completely gone. But when I saw the map of the people that were served, again, a very neat program, that UCC was involved with. So good meeting, and I'm again thank the chairman and E.T. Mitchell for recommending me for that board. Very productive, interesting group of people.
Thank you, Commissioner. Commissioner Smith.
I have nothing to say.
All right, Commissioner Hunt.
No report.
All right, Vice Chair Booker.
Yeah, a very quick question for the finance birthday boy. We had a event in downtown New Bern in the last 2 days where a lot of money got spent. A lot of people were swiping their cards. A lot of these vendors are from other areas. Does that tax revenue from all that money that was spent here the last 2 days stay here, or is it going back to the places where these vendors are from?
Sales tax is supposed to be the point of delivery, where the sale takes place, you take possession of the goods, is where the sales tax should be filed.
Okay.
Should be within Craven.
Should be here. It was unfortunately a little bit of a rain out on Saturday, but yesterday the streets were busy, so turned out to be an okay event. The second thing I would just mention is that several of us went to the Baptist on Mission event. They had a dinner. They have a dinner every night for their volunteers, and they invited us to attend that dinner. It was Commissioner Hunt, Commissioner Smith, and myself, and I think, who else? Jason from our planning department. It was an emotional event because they have been working with a couple in Commissioner Hunt's district, and I'm not going to take a lot of time, but they're the elderly couple whose house was damaged by Florence. The gentleman got up on the roof to try to repair the roof. He fell off the roof, broke his back. Then they had a fire, and he was trying to drag stuff out of the house, and he got severely burned, spent a number of days, weeks in the burn unit at Duke or Carolina, one of the two. They had them there at the dinner, and the Baptist on Men volunteers were putting that house back together. And in the meantime, they were living in their car. Again, these people, I think, are in their 80s. And they were living in their car. They got them we got them through our planning department, got them a trailer, a camper to live in. And you want to talk about two people who were thankful and appreciative. She just was crying how thankful they were of what was being done. The house is still not anywhere near finished because that group of volunteers left. They got to wait for the next group to come in. But I say all that because Baptist on Mission continues to provide for our county, and my fear and concern is their mission is to go in and take care of disaster relief. And now the disaster relief piece is starting to run out, and the fear is they're going to close that center down. I hope not, but they just knocked down 2 more buildings in James City that were vacant and derelict, which brings, I think, to 6 or 8 that they've done there. So anyway, I just wanted to mention what a wonderful group of people this is, and that it's costing our county nothing, and they have done tremendous work on many, 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 many homes. So just wanted to make sure everybody was aware of that. If you're a Baptist, when you make your weekly tithe, some of that money goes out and then comes back. So that's being paid for by the Baptists all over the state of North Carolina who fund this Baptist on Mission organization. So just wanted to mention that. Being a Baptist, I like to make sure I get that plug in.
Commissioner Smith.
Thank you. That's a wonderful story.
Yeah, you caused me to want to speak, so if I may, Jason, I'd like to say a few words. I had the experience of with our county manager, assistant manager, and a few others to drive through my district. We've been doing that, but the needs that we saw is just so tremendous. It's heartbreaking to see the needs that are there. I'm still from the storm and from other things as well, and it makes me very appreciative of Baptist Home Mission. They've done some work in my district as well, and I'm very appreciative. But I hope that other people become aware and know the needs that are in the district, just not in my district, I'm sure the others as well, but we're doing very well in Craven County. But there are a lot of people in Craven County still with a great deal of needs, and they need attention. Some things that they cannot do. We need to open our hearts and our pocketbooks and see what we can do for these people.
Mr. Smith,
Yes.
tell them about the basketball court.
Yes.
Well, in my community, actually the community I live in, we had a need for a place for our children to play. We have a community center that was damaged by the storm and by disrepair from the years of lack of service, I guess. But anyway, a Boy Scout troop, not from my district, and I apologize for not remembering the name of the troop at this point, but this Boy Scout troop decided that they would repair the basketball court. And one young man's father, I can't remember, was a doctor, and
George Cassiello.
Okay, say that again because I don't have. But anyway, go ahead.
The young man is George Cassiello. He is a high school junior. He started this when he was in 9th grade.
Yes, and I wish you could see that court. It is so superior to any other playground, anything we have in the community. It is wonderful. And during the presentation, I was absent. I was out of town, but I did leave a letter, a note to them. But the sister said that she wanted to do something for the community as well. That is so fantastic that these people are reaching out to my community and communities like mine, seeing a need and being willing to work and to give out of the goodness of their heart. I really appreciate that.
Yeah, he was doing his Eagle Scout.
That's right.
Trying to working for his Eagle Scout badge.
He should have get many badges.
And he raised close to $50,000.
Right.
donations from citizens to get that court redone.
No, he's
Pretty
correct.
amazing story.
His dad did.
Yes.
Thank you. Thank you all for your comments. Great stories to share about the great people we have in Craven County. Commissioners, we do have a work session scheduled for the remainder of this day. It's going to take us a few hours. We're going to take a recess until at least 9:45. We will come back into this room. They're going to set up in here so we can sort of be like we are during budget time. We've got a lot of presentations this morning, so we will take a recess until 9:45. You need anything, Mr. County Manager?
No, sir.
All good.
We're just gonna clear out and set it up.
All right.